Polycystic ovarian syndrome. It is something that affects at least 10% of women and about 5 to 6 million people here. Um, Very high prevalence among South Asian teens, especially those who are obese. To talk more about this issue, we have Dr. Neelofer Basaria, our health and wellness coach, in the studio with us today. And hello, how are you?
I'm doing well. Back from my wonderful break. It was lovely.
You're looking nice and fresh, so
Yeah. Thank
that's
you.
great. So you can connect with Dr. Basaria at drbasaria.com, Basaria, and of course, Dr. Basaria on Instagram as well. And her phone number is 469 645 8681. Um, in our community, the South Asian community, PCOS the experience tends to be more severe and affects our reproductive and metabolic manifestation, right?
Mhm.
थोड़ा सा आप हमें बताएं कि what causes PCOS and then what are the symptoms and how is it diagnosed?
Okay. So basically, PCOS is not only the problem with our ovaries,
Mhm.
the root is metabolic,
Okay.
which means the whole body is involved, right? So
Mm.
your muscle cells are involved, your liver cells, your fat cells, your gut is involved, your hormones are involved, your circadian rhythm is involved. So all of this is working or dysfunctioning. There's some dysfunction happening because of which you see PCOS. It's a syndrome, right? Polycystic ovarian syndrome.
Hmm.
So basically, what happens is your body becomes resistant to insulin,
Okay.
right? And so, what that will do is that always will raise your blood sugar if you are resistant to insulin, right? Because body is not responding to insulin.
Mhm.
So, blood sugar goes up, and as a result, your ovaries are going to produce more androgens, which is more male hormones. So we produce some testosterone, right? But in case of PCOS, because body is so resistant to insulin, sugar is high, we produce more testosterone, and that disbalances our female hormones,
I see.
which are
Estrogen.
progesterone and estrogen,
Mhm.
right? So that disbalancing happen, and then you see irregular cycles, right? You also see in PCOS mood swings, acne, hair growth,
Mhm.
um,
Especially around the face,
around
right?
the face,
Mhm.
chin area, upper lips, and neck
Sideburns.
also
Mhm.
sometimes. And then you also see weight issues
Mm.
because of all this dysfunction. So think of it as a traffic jam,
Mhm.
right? So your insulin is a traffic light, or that's your cop, right? If insulin is not functioning fine, if your traffic lights are not functioning right, you will see a backlog, right? Everything will clog up, right? Because the lights are not functioning fine. So that's what's happening in your system. So what we got to do is we got to work with insulin so that we can then work with everything else.
Got it. Okay. How is it diagnosed?
So when young girls have irregular periods, and they don't get regular, then a lot of times, when they go to the doctor, um, there is some hormonal test that's done, and then you see that, you know, there is a problem there. Or sometimes when when women are trying to get pregnant and they cannot, then this is diagnosed.
Hmm.
Or sometimes when you have a strong family history
Mm-hmm.
of diabetes, weight gain and all those things, everything combines, and then that gives a clue that there might be a lot of hormonal disruption that's going on in your body.
So is it something that is genetic, that's passed down from generation to generation, and is it a dominant gene at that?
So, yes, anybody can get PCOS, but females who have a genetic history of diabetes or PCOS, they are more susceptible. So,
Mhm.
if the parent had it, diabetes or PCOS, the child may suffer from it. And the other thing is, if you have started your periods early and they have always been irregular, that
Is a
can be,
strong
strong
indicator.
indicator.
Mhm.
The other is, of course, like you mentioned, South Asians.
Mhm.
It's very prevalent in South Asians and Middle Eastern women. And then, if you are struggling with a lot of metabolic weight issues, then you're more prone to um, PCOS. But thin women also have it.
Hmm.
So know that weight is not a cause; it's a symptom. So the actual cause is, like we talked about, it's more metabolic.
Mhm.
It's your body's response to insulin.
Okay. Okay, got it. So why do women with PCOS gain weight so easily even when they're eating healthy?
Yeah. So see, think of your body in PCOS. Think of your body as a locked door. Okay, and insulin is the key.
Okay.
So if insulin is not functioning right, your body will store more fat around belly.
Mhm.
Your sugar will go up, right? So it's not about reducing calories. It's not about eating less.
Mhm.
It's more about how we can work with our body so we don't have insulin resistance. So
Okay.
our body is not just flushing out insulin.
Mhm.
All right. So that's where the work needs to happen, not at reducing calories or restricting yourself.
Mhm.
That's more important.
Okay. Okay, that's good to know. You mentioned that there are women who are trying to get pregnant and they're having a hard time. So, does PCOS affect fertility and can it also cause miscarriages?
Yes, it does affect fertility, again, because it is disrupting your hormones, insulin resistances. So you have to regulate the cycles first.
Mm.
So your ovulation has to be regular for you to get pregnant,
Mm-hmm.
right? So there are different interventions that are done. Of course, lifestyle is the most important. And then there are some medications that are used. Um, and miscarriages, yes, again, because miscarriages happen how? You, the very important reason is your uterus lining is not supportive of uh, the the
Embryo.
baby,
Mm-hmm.
right? The embryo, right? So then it sheds. So we see in PCOS that a lot of disruption of our estrogen and progesterone is happening.
Mm-hmm.
Why? Because again, the androgens male hormone is high,
Mm.
and that's disrupting the other hormones.
Mm-hmm.
So yes, yes to both.
Yes, to both. Okay. Talk to me a little bit about cycles. You know, we're always told that the typical cycle has to be 28 days. What is research showing that? Is it okay to have cycles 28 to like 35 days, or does PCOS cause longer cycles and delayed ovulation, contributing to infertility?
Yeah. So, everybody has their own rhythm. So some people have to the dot 28-day cycle. Some people have 30-day cycle,
Mhm.
35-day cycle. But as long as, you remain within the cycle that you have.
Mm.
Say if you have a 28-day cycle, but you are going to 35, 40, 45 days, that's not normal for you,
Mm.
right? So very important to first determine what is your rhythm, right? Uh, the next question you had was,
It was basically, okay, does this then affect the time of ovulation? So, and
yes,
hence
absolutely.
getting
So,
pregnant.
yes, yes, yes. So, PCOS definitely it disrupts your ovulation,
Hmm.
right? Because your hormones are disrupted. So, in the beginning of your cycle, estrogen has a lot of role. toward the after ovulation, progesterone
Progesterone.
has a lot of role, right? And if during ovulation you're getting pregnant, then progesterone has a bigger role. So if estrogen is disrupted, if there's a lot of testosterone, you are not going to ovulate properly, and that will impact your getting pregnant. So it's very important to address this issue,
Mhm.
and which is not, again, an estrogen, testosterone, progesterone issue. It's more metabolic. So we have to go down
Deeper.
the cycle, yes, and address insulin and then cortisol.
Okay. Before we get into that, and I know dealing with the gut health part of PCOS, how does conventional medicine treat PCOS?
Well, conventional medicine, when you go to the doctor, of course, they are going to give you birth control pills so to regulate your cycle. So again, that's a patch, a pause, a fix for some time. If you're off of birth control pills, again, you will see the irregular cycles. So it's not solving for the problem, it's kind of working on the symptom. The other one is metformin to increase insulin sensitivity. Now, a lot of people, they don't do good with metformin. So that can be a problem for them. Some people respond very well to metformin. So metformin is another treatment sort of that is used in traditional medicine, in actually Western medicine. Then the other one is Clomid to for the fertility. And
Induce
if you want to
ovulation. Yeah.
induce ovulation, to get pregnant. The other one is, giving you some steroids to stop acne, hair growth. So, because that will curb the androgens. So, those are different treatments in the beginning that are used to address
PCOS.
PCOS, but they are just, like I said, they are just tapping to the symptoms. They're not going to the root, which is metabolic.
Okay. How about these new GLP-1 medications that are out there, Ozempic and Wegovy? Are they safe and effective for PCOS?
Well, see what these GLP medications do. They reduce your appetite, right? They increase insulin sensitivity. They help in weight loss. So, yes, if you see mechanism wise, it is good for PCOS, but they are not specifically recommended by FDA for PCOS. Okay. So you got to work with your doctor. And so if they see that you are at a certain weight where you are also very prone to diabetes, or you are a diabetic, say for instance, and under their supervision, if you're using GLPs, then that can work. But one thing I will always say for GLPs in general, they are not good by themselves. So you have to use them in combination with lifestyle. Don't consider them as a replacement of lifestyle and as a treatment, because the moment you come off of it, the whole cycle is just sitting there. The bomb will blast again, and you will gain weight. Your hormones will get disrupted because you've not addressed the deeper problem,
The root cause
the
of it
root
all.
cause.
Okay,
Yes.
got it. So, Neelofer, tell us a little bit that about lifestyle changes and how they make a difference for PCOS.
They absolutely make a big difference. So I would say yes, yes, and yes to lifestyle changes. So you see, because we've been talking about, okay, what happens. So what happens metabolically, your muscle cells are not responding to insulin, right? So you're not using glucose. Your liver cells are not listening to insulin, and they're producing a lot of fat, so fatty liver, right? Your fat cells are full of fat, and they are now putting this fat in your bloodstream. So fatty acids are coming into your bloodstreams. So, all of this is not functioning right for you, right? Your gut is producing a lot of inflammation. That will not work for you. Your cortisol, if your circadian rhythm is not right, then that body is not functioning right because cortisol is up, which will raise your blood pressure, blood sugar, right? Similarly, if your gut is not fine, then your hormone regulation will not be good. The way body metabolize insulin, testosterone, that will be affected, right? So you got to address all of this. So you cannot take one pill. You have to do lifestyle, right? So if your blood sugar is not spiking, that will help your muscles to function well, right? So if you're eating right and eating the foods that are good for your body, then that will definitely help, right? The second thing is if you're active, right? Then again, your muscles will consume more sugar. So that will help, right? If you are not stressed, if you're sleeping well, which is also a lifestyle thing, that will put the cortisol down. That will help, right? If you even lose 10% of your weight, so if somebody is 200 pounds, even just losing 20 pounds will change insulin resistance in their body. The research has shown us. So, a lifestyle is the way to go for diabetes, PCOS, right? All these metabolic conditions, cardiovascular conditions, everything. So, I would say a big yes to lifestyle.
Okay. And let's expand on this a little bit. So, what kind of diet works for best for people with PCOS? And does it mean that we have to cut out all carbs?
No, we don't have to cut out all carbs, but very important for people with PCOS to have good fiber in their diet and protein. So you see, perfection is not the key. It's the direction of how you take your meal. So load up on fiber in the beginning as you start your meal. Okay, so you take that a lot with your vegetables, all right, and protein. Okay, load up on protein. So fiber and protein, remember that. It's the way you eat. Okay. The next thing is having anti-inflammatory fats. So antioxidants, right? So your omega-3s, so your salmon and your sardines, or your chia seeds, flax seeds, hemp seeds, your nuts, avocado, those are very good anti-inflammatory. You need that in your body, right? And make sure that you are substituting refined carbs with complex carbs.
Okay.
So your lentils and your beans, so legumes, right? And then quinoa, those are much better than processed foods and white carbs and sugar loaded like that. Will spike your sugar like that. So don't think that carb is your enemy. You got to eat the right carbs. Okay. But like we said, how do you start? Load up with fiber and protein, anti-inflammatory compounds then, and then substitute your carbs. And water is your drink, because we take a lot of sugar. Not like, by eating, we don't take as much as we take by through drinks, right? Because it's very, very quick, right? And it doesn't need any digestion as well. So the sugar spikes up really high. So water is your best drink. So imagine your plate. Half of it is vegetables, 1/4 is protein, 1/4 is good carbs, and then you have like a dash of good fats.
Yeah.
That's how you eat, and that will support excellent metabolic health. So again, remember, it's not about perfection. Choose your plate well. It's the direction of how you eat.
Choose your fuel well.
Choose your fuel well, and give the real estate to the right fuel to your body. Your body is pristine. Don't treat it as a trash can.
Very, very important. We know, I mean, through everything that you have taught us, how bad sugar is, and that goes without saying. How about caffeine and things like coffee?
Well, caffeine don't have empty stomach, but caffeine can be a good antioxidant too. So again, in limited amounts. Don't get addicted to anything. In addition to that, like if you are a green tea person, that's excellent. That's really good because there are a lot of antioxidants there. So, and that will definitely help with PCOS.
Okay, good to know. What about exercise? What kind of exercise should we be doing for PCOS?
Hands down, resistance training, strength training. Hands down. Like, yeah, your aerobic exercise will help, but that's more for your cardiovascular health. For PCOS, you got to make your muscles work for you, right? And so for that, you need your hinges and your push-ups and your pulls and your weight training, right? So build your muscle. Your muscle is your asset. So yes, the scale is important, but the strength of your muscle is another metric that you got to see for PCOS. Very important. Um, Walks are good, especially after meals, because you don't want to, there's no way you want to spike up your sugar because you know that we have some insulin resistance. So we got to help our body. And so walks, 15-20 minutes after meals will really help.
Good to know.
Yeah, but go for resistance training for sure.
Very, very good advice. We're in conversation with Dr. Neelofer Basaria, a health and wellness coach, right here on Radio Azad. And we are talking about PCOS, Polycystic Ovarian Syndrome. You talked about that it's a syndrome. What is a syndrome?
Syndrome means that it's a collection of symptoms, right? So you see irregular cycles, you see mood swings, you see hair, acne, right? Weight gain. So this it's a conglomeration of all these symptoms,
I see.
right? So that's why it's called a syndrome.
Okay, okay. Your favorite, sleep.
Yes.
How
yes,
does
yes, yes.
sleep affect PCOS and weight gain?
Well, sleep is so important because your circadian rhythm is important. We come from nature and we have a rhythm, right? So when sun rises, we have to be up. When sun sets, we have to slow down our activity. So if we are not doing that, if we are not sleeping well, if there is irregular sleep or short sleep, okay, both will impact your insulin resistance because it will raise cortisol in your body. So if some people ask me, well, I sleep at 2, but I am up, I let myself sleep. So I'm up at 11 or noon. Is that not enough? That's not right. That's not going with the rhythm of your body. So very important that you see the morning sun at 6, 7 a.m. Very important. Some people, some of my clients wake up way early for prayers and all, 4 a.m., 4:30. You gotta sleep early for that because you need your, everybody has their own normal. So some people are fine at 6 hours of sleep. Some people need 8, 9 hours. So see what is your normal when you are, waking up in the morning without an alarm, without pushing yourself, when you are rested. So know your normal. And then, around 10:30 is a decent time to go to bed. And then, when you wake up at 6, you are fresh and you see the morning sun. So extremely important to put your cortisol down, and that will help with insulin resistance. So if cortisol goes down, insulin resistance goes down. And remember, we are working on the root, which is that even one night of disrupted sleep has been shown to mess up your week worth of clean eating. So imagine how hard work you do to eat clean, and then you don't sleep, and that can disrupt the, because what happens inside the body, it just takes turn towards the south. So so it doesn't help. So make sure that sleep is sacred. Make sure you treat it like a prescription. So if you see that, this thing is building up to my sleeping late, take some action there. Speak up, say no, give priority to your sleep.
And I've seen this, like you get into a rhythm and then, it's like at that time you just feel so sleepy and you're like, I really need to get to bed now.
Yeah. So that's why body likes rhythm. So if we push it out and we are like, no, yeah, there are, there are social events there. Yeah, there is some room for that. But if we are consistently, I have seen people, they just consistently, because they either they are, the reason is that I cannot put myself to sleep, I can go to sleep early. So they scrolling and screen time near bedtime is just so bad. So at least make a rule for yourself: 30 minutes to an hour before sleep you are doing away with screens, especially your phone, or if you're scrolling, that doesn't do any good to you.
Yeah.
So that's just delaying your sleeping time. So also I tell people that if you wake up early in the morning, that will help you with sleeping early. So yeah, social events and all those are important. There's some room for that, but just consistently not taking care of yourself and putting your sleep at the back burner will not help, and especially will not help to people who have PCOS.
Good advice.
Yeah.
Why is stress management so important for hormonal balance as far as PCOS is concerned?
Stress management, again, if you are a stress prone person, if you're overwhelmed, if you're worrying, all of that is raising cortisol in your body. When cortisol is high, your muscles are not going to take sugar in. Your liver will not listen to the insulin and it will continue to make fat. So you will have fatty liver, right? So that's why I said insulin and cortisol, they work hand in hand and they're both important, right? Especially for people with PCOS, you know, um, their sugar spikes are high, right? Body is, the moment you eat a meal, you see a sugar spike and that stays for long. And the longer it stays, the worse it is. So you have sugar spikes. And then if you are stressed, then of course you have mood swings. And that is a perfect combination for emotional eating, for cravings.
Yeah.
Right. So stress management is just so important. Your cortisol will go down, your insulin resistance will go down. So very important to address your stressors. See where the stressors are coming from your work, from relationship, where. Go deeper into why you respond to certain things the way you do. Breath work will help, definitely. Journaling will help. Self reflection will help a lot. Um, Giving a break to your nervous system, extremely important. If you are always on fight or flight, always cortisol is high, it's not good. So take breaks, music, exercise,
Breathing.
prayer, breathing,
Yeah.
talking to a friend, during the day. Those are speed breakers. Very important to take. Remember, cortisol is its function is as a matchstick. So you want to get up from bed, you want to go work. That's important, and that's why cortisol is important. But if it's a fireplace, it's just constantly going on, not good for you. So cortisol has its role, but if you are overwhelmed, extremely stressed, chronically stressed, it will not help you with PCOS.
Good, excellent. How is gut health connected to PCOS and hormone regulation? I know you've touched upon it a bit.
Yeah, gut health is the basis of it all. Gut health, if you heal your gut, if you take care of your gut, then you have taken care of everything, sort of. So, what happens in women with PCOS, they have a lot of gut dysbiosis. What is dysbiosis? It means the balance of good and bad bacteria in your gut is disturbed. Okay. So now you're having a lot of bad bacteria which are doing a number on your gut, and your gut lining is impacted. And so a lot of toxins are entering into the bloodstream. And the moment the blood sees it, it mounts an attack toward it. And hence inflammation starts from here. Then it goes to your muscle cells, your liver, your fat cells, all over your body, your reproductive organs, right? So we gotta take care of gut health to address the dysbiosis, to actually balance this microbiome, this entire world of microorganisms that are living in our body. The second thing is very important. gut health is why it's important is it is involved in the metabolism of our reproductive hormones. So testosterone, estrogen, progesterone. So if they are not metabolized well, they are not broken down and taken out of our system, then we will have a dominance of these hormones, which again, that's a wrong signal for the body, right? So your gut needs to function well, and gut health is so individualized, right? One food that is good for you may not be good for another person, right? So if, say, steel cut oats, excellent for, they're full of fiber, um, they will help reduce your cholesterol if you have that. But for some people, it just spikes up your sugar like crazy. Who would say that, right? Steel cut oat is excellent.
Okay.
Similarly, spinach. There are foods that are good for one person, but they are entirely bad for another person's system. So gut health is very individualized. You have to learn and understand your body and eat according to it. And gut health is not only food. It is also your stress, and it is also your sleep, and it's also your activity.
Exercise. Yeah.
So gut health is highly impacted by your lifestyle. So that's why we've been talking about lifestyle. And if you take care of that, your gut health will improve. And gut health is the beginning place of all the problems in the body. It's extremely important.
Great. Wonderful. Wonderful. Neelofer, which supplements are most helpful for PCOS?
Yes. So some people use berberine. Berberine is sort of your
What is it? Berberine.
berberine is like insulin. It functions like insulin in your body.
Okay.
So it works for some people. And acetylcysteine, which is an antioxidant, is also good as a supplement. The other ones is inositol. So inositol comes in a combination. There is a ratio that you got to maintain. So that is also good for insulin resistance in some people. Then your omegas are very important for to stop inflammation. So omega 3s, you can take it in a supplement form. Magnesium, very important to reduce cortisol, help in sleep. And vitamin D, if you have, and majority of us South Asians, especially anybody who has come to me, all my either Caucasian, South Asians, Hispanics, we have a deficiency of vitamin D. Vitamin D will not help. If you have deficiency of vitamin D, it will not help with PCOS. It is so important to regulate your hormones. So please make sure, get your vitamin D checked. And more than likely, you will be deficient because we don't go out in the sun so much. Substitute. Take a supplement. Very important. Remember, supplements are, just as the name says, they are supplement. They are not a replacement of lifestyle, just like medicines, but they will help. So some of these are important.
Interesting. And excellent advice that we can all follow. What's the number one change that a girl or a woman with PCOS can start today to feel better?
So know that the best pill that you have for PCOS is your plate, right? So change your plate. I would say if you can do that, like we talked about, half of it should be vegetables, 1/4 protein, 1/4 your complex carbs, and eat according to that. What you're eating is important. When you're eating is also important for PCOS. You cannot eat late at night. So keeping your cortisol down, your mood better, very important. How you eat is also very important. So eating in a rush, when you are not paying attention to your food, not breathing, overloading your food, eating too fast, that will not help. Why you eat Do you eat because the food is available and free, or your body really needs the fuel? So, your plate is extremely important. I would say just change your plate and you can change a lot of things in your body.
Excellent, excellent advice. Why do women with PCOS struggle with body image issues?
Yeah. See, it's so difficult, right? Because you have weight issues going on. Then at the same time, you feel like your when your cycles are not regular, there's something in the back of your mind that I feel less of a woman. You see acne, you see hair on your face, and so there's a lot of body image issues that comes with it. But know that it's not about all of that, because we don't speak up about it, we don't address it. That's why this has become a monster. By addressing it, by speaking up about it, by talking about it and saying this is a syndrome, this is a natural metabolic dysfunctioning that's happening in the body. It is not that I am any less of a woman. It's just that I want to, because of my family history, or, what my gut likes and how I eat, um, my body is um, responding differently. So I got to address the real problem, and then it will solve for itself. So when we address it, when we speak about it, when we see the actual dysfunction scientifically, then it's not a stigma, or it's not something which is an image issue. It's more like any other dysfunction or disease in our body. We just got to address it, and then that'll help.
And we as mothers, how can we support our daughters who may have PCOS?
First, understanding that this is not your doing as such. Your body is, it's very difficult, but because see, with PCOS, like we talked about, you have a lot of cravings, you have mood swings, so your hormones are not functioning fine. So if a younger teenager is having any mood swings, or they are eating, opening up the pantry and trying to eat, understanding that this is chemically driven in her body. So mothers have to give appropriate help to their teenagers, not by saying that, hey, you cannot eat this, or by saying, hey, you, every time you do this, or you cannot stop yourself, or stigmatizing it somehow. Understanding that the body chemistry is taking the child toward that food, or they're acting up, right? So understanding them, and then getting them through the right help, because there is a simple way, step by step procedure, that if you follow, your body will function fine, right? But to a child, it's not a parent, they don't know. In fact, the mother doesn't know, if she has not studied this, or she's not in the. So getting some professional help will definitely help to both of them. I would say the last thing you should do is stigmatize her, or put her down, or not understand her. So the best way to help is to get some help.
Excellent advice. We will open the phone lines now, 972-501-9390, or you can call us on our WhatsApp line 469-830-4083, 469-830-4083. You can look up Dr. Basaria at DRBASARIA, drbasaria.com. Follow her Insta handle, Dr. Basaria, and you can call her also at 469-645-8681. Any last words before we conclude this segment?
Yes, what I will tell you is, like, PCOS, I think it's an invitation. It's an invitation for you to understand your body, to nourish your body, to slow down, right? And be a leader for your health, for your own health. So if you're going through this, don't think that it defines you. It actually refines you. It doesn't define you, right? It is more about bringing yourself, your body, into alignment. So your body, your mind, your heart, your soul is in alignment, then you will function fine. So don't take this as a stigma or something, a puzzle that is very difficult to solve or unsolvable. You can take care of it. You can take charge and you can take the leadership for your own health.
Very hopeful and optimistic words. And absolutely, the link is there, the science shows it, and it is a journey that you embark upon. And then the thing is to take your health and wellness in your own hands. Sometimes we have to do that, and we have a blueprint for it, thanks to you and science and research, which shows us the way, and you just have to follow it. I think a lot of it is being disciplined and just following it. And once you embark on that journey, then you stay, you stick to it, and it feels right. When you're transgressing, when you have to pull back.
Yes, absolutely. First, getting some help and knowing what are the right steps, and then taking those steps. And then I think your body keeps you to that because you feel so good and things just function so well that you don't want to change it. And then it
Mm,
becomes a second nature.
yeah.
But if you don't know and you're just going in the dark, then you get frustrated. And when you get frustrated, you don't want to do
Mhm.
that thing. So that's why having that light bulb, knowing what to do, what are the steps that you need to take, will make a huge difference. And sometimes when we are in that hole, in that dark, all we need is a little light. So go for it.
Perfect. Thank you so much. Invaluable advice. And thank you again for being on the show. Don't forget to download the Radio Azad iPhone or Android app to stay connected to our live shows. You can get this show in its entirety on the Radio Azad team YouTube channel. So do hit that subscribe button